Hi, I'm Dr. Raj Sureja of the Orthopedic and Spine Center in Newport News, Virginia. Today we're going to be talking about epidural steroid injections. Epidural steroid injections are one type of spinal injection that is used to treat a painful spinal condition. Different types of spinal conditions include degenerative disc disease, pinched nerves, and spinal stenosis. The type of injection that's appropriate for you will be determined by your pain physician or spinal surgeon. The medications that are used for this type of procedure include a local anesthetic as well as a steroid such as a cortisone. The reason we use these types of medications is that we want to flush out inflammatory chemicals within the epidural space that may be causing pain and irritating the structures within the spine. The other reason we use cortisone injections is because that cortisone is an anti-inflammatory medication. One of the goals of putting an injection into the spine is to reduce inflammation of either a painful disc, a painful nerve, or reduce inflammation within the spinal canal itself. Typically these injections may last anywhere from 3 months to several years depending on the patient's age, degree of degeneration of the spine, as well as whether or not they have other comorbid conditions. The epidural space is an important area that communicates with the discs as well as the spinal nerves, and it's a place where we can place medication that can reach both of these areas as well as arthritic joints of the spine. If you look at the spine of the lower back, you can see that in the back you have the different vertebrae, and from the sides you have the canals where the nerves exit. If you look at the spine from the front, you can now see the intervertebral discs, or the suspension system for the spine. Oftentimes these discs can herniate and compress the nerve. One way of treating this nerve compression or disc pain is by placing a medication directly near the source of the pain and inflammation. The epidural canal is actually behind the spine, and it has the spinal cord as well as the nerves contained within it, as well as the spinal fluid. So the injection is placed usually either within the epidural space or right as the nerve exits, and depending on the type of pain the patient is experiencing. Typically, these injections may last anywhere from 3 months to several years depending on the patient's spinal condition. If they have severe degenerative changes or a severely herniated disc, the injection may serve as a diagnostic tool to help determine if their pain is coming from that part of the spine. Typically, these injections can be given anywhere in the spine, in both the cervical, thoracic, and lumbar region. It can be used to treat painful spinal conditions as well as painful conditions of the arms as well as the legs from pinched nerves. Please talk to your doctor further to discuss what type of injection may be appropriate for you, and good wishes.